Good afternoon and thank you for joining us. My name is Tina Tebow and I'm the Director of Media Relations for the Province of Nova Scotia. I will be your moderator for this afternoon's press conference. Joining us today, the Honourable Stephen McNeil, Premier of the Province of Nova Scotia, and Dr. Robert Strang, Chief Medical Officer of Health for Nova Scotia. Go ahead, Premier.
Thank you, Tina, and thank all of you again for coming. We'll start off by asking Dr. Strang to update us on where we stand with the COVID-19 cases here in our province.
Thank you, Premier. Good afternoon, everybody. Today, we're announcing 10 new cases of COVID-19 in Nova Scotia. Like earlier cases, they are travel-related or connected to earlier announced cases. They are not the result of community spread. That brings the total number of cases of COVID-19 in Nova Scotia to 51. The individuals affected range from under 10 to in their mid-70s. We have, as I've said previously, cases located across the province. Public health continues to be in contact. As soon as we become aware of a case, we are in contact with those individuals and work with them to identify who they may have been in close contact with. And all those close contacts are put under self-isolation for 14 days. To date, we have had 2,474 people test negative for COVID-19. But we know that as the number of cases continues to rise, and we will get more cases, we can expect we will soon see community spread. That is why we're taking the actions we've taken. All the things around social distancing, around all the restrictions we put on the public health order, all the public health measures we're asking people to take, such as hand washing, staying home. It's all about minimizing the spread of this virus within our province. That's critically important that we do that to keep each other safe, to keep those in our communities who are most vulnerable from minimize their chance of getting infected and getting severe illness, and protecting our healthcare system. I know that people are making many sacrifices to do this. What we're doing is creating a significant turmoil and disruption for people, but it's critically important. Our collective actions do matter greatly. As the Prime Minister has said, if people want life to return to normal, they must follow the direction given by public health and minimize contact with people as much as possible. I do have some good news, though. Lab capacity, we're building that as we speak, and I want to really thank Drs. Hatchett and Dr. LeBlanc and their team for working at the QE2 microbiology lab, the hard work to build capacity. We're now at a position that our capacity in the lab has now doubled. So we have gone from the ability to deal with 200 tests a day to about 400 tests a day. As a result of that, we're now able to begin testing all the close contacts that I referenced earlier that public health is identifying. So every close contact of a case, we're not just putting them in isolation and seeing if they get sick, we're testing them right away. And we will be going back and doing that testing for close contacts back to our very first case. We're also testing people in hospital who are clinically appropriate, where we might consider COVID-19. We are testing all those individuals. So in those ways, we're starting to look at how we might detect spread within our community. So that testing is not necessarily based on a travel history. We are also announcing today that in a revised order that beginning today, regulated health professions, with the exception of physicians, nurses, nurse practitioners, pharmacists, and paramedics, all other regulated health professions can only stay open for emergent or urgent cases when that care is done face-to-face, or they can also provide, they still can have the capacity to provide virtual care. And they can do that face-to-face care as long as they're meeting all the requirements of social distancing and cleaning protocols within their office. Non-regulated health professions such as naturopaths, some massage therapists, Chinese therapists must close. The only exception is podiatrists, who also have to follow the directions of face-to-face only with urgent or emergent cases or through virtual care. Before I turn it back to the Premier, I want to follow. It's unfortunate that I have to say this, but we have had cases of people calling 911 and at least one circumstance, somebody coming in and into a hospital where they have not been truthful about their travel history. It's really important, first of all, that 911 is there for only emergencies. If you're concerned about COVID and COVID testing, use the 811 online assessment tool, and if necessary, call 811. You should only call 911 if it's an emergency health issue. And if you do call 911, it's critically important that you're truthful about your travel history. The same goes for people going into hospital for any kind of care. As I said, it's unfortunate I have to say this, but it's important that you are truthful from the very beginning about your travel history. People will receive the care they need no matter what their health issue is. But if you do not tell the truth about travel history, we cannot be alerted about the potential for COVID-19, and you're quite frankly putting other people, especially our healthcare workers who are very vulnerable and working extremely hard, you're putting them at risk. So please tell the truth about your travel history.
Thank you, Dr. Strang. We have tightened up Nova Scotia's borders and the movement within our province. Now I want to talk to you about what we are doing to keep people safe. Along with what Dr. Strang has said about doubling our testing capacity, we are also increasing capacity at 811. We have added 53 nurse and telehealth associates to handle the volume of calls and training another 40. We're also doubling our phone bank. We have 79 lines when we start it. In the next 48 hours, we'll have 138 lines. We are doing this to better support the number of people who are worried about their health. It is imperative that if you feel sick, and we are not talking about the common cold, we are talking about a spiked fever, a new cough, shortness of breath, or crushing fatigue. We want you to first call 811, look at the 811 website, and check your symptoms with the assessment tool. And then, if you are prompted, call 811. We have built up resources to get to your call sooner, and the voice on the other end is there to help. We're also expanding our virtual care so that doctors can continue to practice remotely to minimize your need to leave home. We're also doubling down on the cleaning of our hospitals. Many of our cleaners have been redeployed from areas like clinics that have been suspended to high-risk areas, emergency rooms, ORs, or high-traffic areas. They are disinfecting all spaces daily, including every surface. Our cleaners are an essential service in every sense of the word, and I want to thank them for taking on this very important and challenging work. We have had lots of questions about essential service, and I'm here to help clarify. If you are a company, for example, that is part of the food supply chain, we need you. If you are a financial institution that cashes checks this Friday, seniors need you. We have a number of categories of essential service: health, public service, including police, fire, IT, telecommunications, critical infrastructure, food, agri-food, fisheries, transportation, and construction, manufacturing. And we will have a comprehensive tool posted online very soon for companies to look at. Just be patient. These essential services are exempt from the 5-person social gathering rule. Work is not a social gathering place. Employers are expected to follow public health protocols, disinfect your workspace, follow hand-washing rules, and find creative ways to keep your workers safe. Some businesses are running double shifts so that there are fewer people on the floor at any one time. Fish plant workers are naturally covered head to toe with protective gear, and banks can separate their tellers. These are just a few examples. We all need to be working together and supporting one another. I am grateful to our municipal leaders and community leaders who are working with us across our province. I want to take a moment to thank those municipal workers that are essential: garbage collection and transit workers. I know operating a bus during this time has been stressful, but you are providing comfort and security to healthcare workers, people working in pharmacies and grocery stores who need to get to work. We need them. That is why we need you. And we want to thank you for the work that you're doing. And we'll be happy to take any questions that you have now.
So we'll go to the phone lines for questions. Again, we have 19 reporters on the line. We have approximately 25 minutes. Unfortunately, we won't have time for all your questions. We'll start now with Keith Doucette from the Canadian Press. Go ahead, Keith.
Good afternoon, Premier Dr. Strang. It's 3 days since you instituted the state of emergency. We've been talking with local police forces, and there have been no tickets issued yet. What's your take on that? Is the approach being stern enough in your estimation, or is this a sign that what's in place is working?
We look at the measures that we took with the measure on Sunday is providing and giving people clarity. People have been responding to that in a positive way. I do know that police have had at different times talked to individuals, and once been spoken to, they then have dispersed and moved on.
Do you have a follow-up question, Keith?
Yeah, so just to follow up on that, is there a chance that this could be tightened at some point based on feedback you get from police forces? What's your message to people over that?
Well, I don't want anyone to think that it's been relaxed at all. Police have the authority and the ability to fine individuals up to $1,000 for each day, each offense, and companies $7,500. The reality of it is, we knew when we started, police were going to ask people to cooperate, and people are cooperating. If they stop cooperating, they can fully expect the law enforcement to execute the law and fine them.
Thanks, Keith. Next, we'll go to John McPhee from the Chronicle Herald. Go ahead, John.
Dr. Strang, we've heard from people who believe that they have COVID symptoms, but they're told that they don't qualify for testing because they haven't traveled. Should we be revisiting the testing criteria?
So that's exactly what we're doing. We know that we're focusing our testing up till now based on travel history, but we've always been testing anybody who's sick enough to be admitted to hospital with respiratory illness. We're including COVID testing on that. We continue to do anybody in hospital, coming into hospital, where it's clinically appropriate, testing them. That's why we're now expanding in rather than just self-isolating and observing. Close contacts will now be tested, and we continue to look at other ways to expand our testing into the community. And beyond just the testing, we're also looking at, as I said yesterday to a similar question, we have continuing through our influenza surveillance, where we look at the percentage of people every day going into any emergency room in the province that meet a definition for influenza-like illness, which if there was a spike in that in any community, we'd be notified and we'd be moving in very quickly with testing. We have not yet had any of those situations. So you're absolutely right. We need to be looking for indications of community transmission. We have been doing that, and we're ramping that up in the ways that I talked about earlier today, and we're looking at ways to very quickly move that even further.
Do you have a follow-up, John?
Yes, I do. This is also for Dr. Strang. We've heard different time frames when it comes to when the outbreak is expected to end and things can go back to normal. Are we safe to say at this point that we're talking months, not weeks? Do we have a better handle on how long we're looking at here?
As I've said previously, when you look at other jurisdictions around the world who are ahead of this and us, it seems to be around 6 to 8, maybe up to 10 weeks that you get through this. But then you can't just flip the switch back on. How you return to normal needs to be a slow transition, like we've had a slow transition. Most people aren't aware, but public health has been working at this since January in Nova Scotia, along with their colleagues. And we've had a slow ramp up, and we'll have to have a similar slow ramp down. Then there's also the issue about more and more, we need to be watching, once the first wave is over, the potential for future waves. So we're going to have to continue our active surveillance and the work that we were doing, similar to what we were doing back in January, February. So the first wave is 6 to 8, maybe a little bit more weeks, and then we still are not out of the woods, and we have to continue to pay close attention to this for quite a long time.
Thanks, John, for that question. Next, we'll go to Shayna Luck from CBC. Go ahead, Shayna.
I'm wondering if you can talk to us more about the person who lied about their travel history. I'm just wondering where and when did that occur, and to what extent were healthcare workers exposed? I guess I'm wondering if anyone who's such an essential worker right now had to be removed from the workplace.
So appropriate steps were taken I've not been given all the details of the case, and I think the details of the individual case are not the issue. The concern, the reason I brought it forward today was that to really have a public message that we need to be honest and truthful about our travel history. People who may have been exposed to COVID, you need to share that with your healthcare provider right up front, because then we can take appropriate steps to protect you and protect the healthcare worker and get the necessary care and testing that you might need. But if you don't do that, you can't get the proper care that you need because the clinician doesn't have all the right information, and you're putting them and other people in that healthcare facility at risk.
Do you have a follow-up question, Shayna?
Yes, also for Dr. Strang. If COVID-19 gets into a long-term care home, what is the protocol that we have? Where and how do people get treated in that circumstance?
So we have. I'm going to answer that in a couple of layers. You're absolutely right. COVID-19 in a long-term care facility is a very serious issue. We're doing everything we can to not allow that to happen. So that's why we put significant restrictions on visitors into long-term care facilities, and also we've stopped people on day outings from the long-term facility going out into the community. Public health, we have a long-standing protocol of dealing with an outbreak of a respiratory illness based on the experience we have every year with influenza. So we would manage an outbreak on those similar principles. And what's already been identified is that if we had an outbreak of COVID-19, we would be looking to find ways to bring the necessary, maybe more acute levels of clinical care into that long-term care facility rather than transferring those individuals into a hospital. So that's part of the planning that is underway now through our model of care that NSHA is leading.
Thanks, Shayna. Next, we'll go to Natasha Pace from CTV. Go ahead, Natasha.
Hi there. I wanted to ask Dr. Strang, we just got an update from the Nova Scotia Health Authority that says there are now 6 hospitals across the province from one end to the other that are now able to accept patients in the hospital if they need to be hospitalized for COVID-19. I know you say there's no community spread at this time, but is that a sign that you're obviously preparing for some community spread at some point in the near future?
So that's a sign of exactly what we've asked the NHA to do, and they are doing well. Be prepared. So those are the COVID treatment units. So that we have facilities in our regional hospitals, as well as our tertiary care hospitals that have people with the right training, with the right infection control support. They're all geared up. The wards are set up. People have practiced putting on the right personal protective equipment. So when a patient with possible COVID-19 comes into the door, they're dealt with in a safe manner that protects them and protects the healthcare worker. It's not just about if we get community spread. We are going to get more cases, as we've seen in the last few days, related to travel. So no matter where people may have acquired it, we need to make sure our healthcare system is set up to deal with the people coming in and they get the appropriate treatment, and a treatment that's done in a way that maximizes the protection for healthcare workers.
Do you have a follow-up, Natasha?
I do. This is for a colleague, for the Premier. You did sort of address this a bit, but there seems to be a lot of confusion in the general public about what is an essential service and what is not. I understand you did address some of this earlier, but are you able to provide a list of what exactly is an essential service, and is the province going to be closing everything that is not an essential service that is still open at this time?
So we laid a number of categories out around essential services that we will be posting on our website. Companies who fit underneath that, like food security is an important one for our province. Our transportation infrastructure, obviously our health care workers are essential. There's a number of others, IT service, critical infrastructure, power, telecommunications are critical pieces. Those are all essential pieces that'll be part of that. And what we have said is they continue to operate, and manufacturing continue to operate, providing you follow the health protocols that Premier. I was going to yesterday I called you Dr. Strange, and today I'm calling you the Premier, so we're all set. we're good. I don't think you're strange, by the way. I'm going to start calling you the good doctor.
And I don't want to be the Premier either.
But we are working to make sure that the workplaces know they're important. And if your work is not essential, we're encouraging people to we're telling people to self-isolate. It's absolutely critical. I think we've started this now for quite some time, and if you look and if you study this and look around what's happening around the globe, where they've been successful is when individuals have taken this into their own hands and have followed the advice of the chief medical officer. Self-isolate, protect your citizens, protect your neighbors, make sure you don't have this virus. The steps that we're putting in place will support that. The testing that takes place, ramping up what's happening at 811, the doubling down on cleaning it at hospitals is if this virus is there, we want to make sure we get it out of there as quickly as possible to protect our healthcare workers. We'll continue to do that. It's why we're expanding out now to the context of those who've been have a positive test. But ultimately what we need from our citizens is, yes, those essential services that are required, we need those, Nova Scotians need them, and we need the rest of us to spend our 14 days at home in isolation with our families, and we can find our way through this, and we can shorten the pain, quite frankly, on the economic health of our province.
Next, we'll go to Lindsay Armstrong from All Nova Scotia. Go ahead, Lindsay.
Hi there. I was wondering if you could speak to the capacity of the COVID units that you had mentioned. We understand we only have one hospitalized case at the moment, but I'm curious to know how many beds are ready to treat coronavirus patients who do need to be hospitalized.
So I don't have that exact number in front of me today. I think that's something in the near future we're looking to get folks from the Nova Scotia Health Authority to join us on one of these kind of media briefings and to give more detail on their preparedness. We have to understand that the COVID units are the start, and we're fully prepared that if those units become full, that we need to then adapt and be able to treat patients in other parts of the hospital.
Do you have a follow-up, Lindsay?
Yeah, just curious if you could give a range. Is it around 10 beds, around 50 beds?
We can try to get back with you the number today. I don't have a figure that's been given to me at this point.
Next, we'll go to Cassandra Nadeau-Lamarche from Radio-Canada. Go ahead, Cassandra.
This is for Robert Strang. So last week you mentioned that doing drive-through testing was not off the table. So what's your take on that now? Is it still the case now that you've doubled capacity at the QE2 lab?
So we have a group led by my Deputy Chief MOH, Dr. Watson Creed, who's been joining us at sometimes in these events. She's leading a group with public health, the lab, 811, and a primary care on what are a number of options that we need to look at quickly to expand testing into the community, people who may be ill and don't have a travel history. A drive-through option is part of that picture. We haven't taken anything off the table. We have to do this what's feasible and realistic, and it's going to work in Nova Scotia.
Do you have a follow-up, Cassandra?
Yes, so this may be for either Dr. Strang or Premier McNeil. So my colleague yesterday was at the border between Nova Scotia and New Brunswick, and they noticed that the provincial agents that were there were not wearing any protective gear, or some were even wetting their fingers with their tongue to distribute flyers to the people passing the borders. So have those agents received any safety training, and what is being done to make sure that they are safe and also that they are keeping the motorists safe?
Speak to that. So they would follow, routine. These are all inspectors in various parts. My understanding is these are the kind of some of our conservation officers. They would have a level of training. I'm going to take the feedback if they're licking the thumb before they hand out paper. Thank you for giving us that information. They don't need to wear masks. We're not looking at people who are symptomatic. They are handing a piece of paper to an individual as much as possible, trying to maintain that 6-foot distance. They're not going to stick their head inside the car window, so they're not going to be exposed. And this is simply about giving people coming into the province. We fully anticipate there's a lot of other measures, especially for returning travelers coming in from other parts of the country, that they go through a screening process at our international airports. Also, people coming from other parts of the country, many of them, if they've traveled from overseas and into another province, they're meant to be under self-isolation within that province. So there may be some people with a variety of illnesses coming through, but are the officers there are in close contact with them, and they follow their standard safety precautions. But thank you for flagging that one issue that we'll take back to them.
Thank you for that question. Next, we'll go to Jesse Thomas from Global. Go ahead, Jesse.
Hi, thanks, Tina. I guess it's kind of a follow-up to a colleague's question earlier regarding hospitalizations. I guess I'm looking for clarification. We're not really getting clear numbers in these press releases, but on Thursday, I think last week, was the first patient hospitalized, and then maybe they were released on Saturday. But since then, we've seen other releases saying one patient remains in hospital. Then even today, we have a line that says one patient remains in hospital while one individual in their case of COVID-19 has been resolved. I guess what I'm looking for is how many patients have been hospitalized and how many have been released so far.
So we've had our total of 51 patients. We've had 2 patients requiring hospitalization. One of them has been released and one remains in hospital. And you're right, we do have one individual that is now at the point where we could say that their COVID-19 infection is over and they're fully resolved.
Do you have a follow-up, Jesse?
Thanks for that clarification. I have a follow-up question. Yes, I guess for the Premier, I'm just wondering, that conference call yesterday with the Prime Minister and other provincial leaders, I'm wondering how that went and if there was any kind of conclusions or direction on getting some federal funding and immediate funding to small businesses, and was there anything about medical equipment and sharing that?
All of that was discussed in the conversation. I can tell you on behalf of Nova Scotians, I raised the issue of ensuring that we had access to medical equipment. We have our teams here, purchasing teams with Inside of Health, continuing to look at every avenue, not just through the opportunity with the federal government to buy bulk buy. We as a province have a number of manufacturers internally in our province that we're looking at how can we tool them up to be able to build either ventilators here or some of the protective healthcare equipment that's in the province. We will look at that provincially, as well as we put their names as part of the national movement to ensure that that equipment will be available. And I raised the issue around it absolutely being critical that funding moves quickly from the national government out into communities. Looking at Atlantic Canada by itself, our economy is built on small businesses. From one end of it to the other, it's different than if you're looking in the manufacturing heartland of Canada in Ontario, or what's happening in Western Canada, the oil and gas sector. It's the small business component that is critical to us. We laid out the idea that the national government needs to do something very quickly on commercial lending, because what's happening is many of these small businesses have rents to pay to landlords who have commercial loans. We need the banks to do as they've done along with personal mortgages by deferring those payments, and that way the lender can then defer the rents of all of our small businesses in the province. We've closed down restaurants, we've closed down small shops. In order for us to economically come out of this at the end, we need the same opportunity for deferment of payments for these small businesses as we've seen happening around mortgages. Otherwise, for Atlantic Canada, not just Nova Scotia, but I argue for Atlantic Canada, our economic health will take a long time to recover from this if we don't get the support globally that understands the uniqueness of Atlantic Canada, the uniqueness of our economy and the small business piece in it. And if we get that, and we work with one another, and the EI program expands for self-employment, we then can continue to focus on ensuring that the health of this population is protected, and then prepare ourselves economically to come out of this, as I know the entrepreneurial spirit of Nova Scotians will allow us to do if we can get that front end help now.
So we have about 5 minutes left. We'll take a few more questions. Next, we'll go to Evan Taylor from CKBW.
Hi, my question's for Dr. Strang. As far as the testing upgrades, I believe you said it went up to 400 today. Are we exploring taking it beyond 400, or do we expect that to meet the capacity of what we would require for the remainder of the outbreak?
So right now today we have capacity to do up to 400. We're not, the original lab capacity is at 200, and we're not exceeding that capacity. But we can, overnight, we can turn that up to 400, and the lab is actively looking at ways to even triple or go beyond that. So we have lots of plans in place to adjust our capacity as we expand our testing.
Evan, do you have a follow-up question?
I do have a follow-up question.
Go ahead.
Some school boards, namely in Cape Breton, they're allowing students and teachers to go back and get some things in order to facilitate education to take place better from home in the coming days. What sort of consultations took place to ensure that that is a safe thing to do?
I'm aware they're doing that in a very controlled manner. Teachers and students have the phone, they have to make an appointment. It's all, they're not letting just everybody go into the school. It's done one at a time. We got to understand there was no COVID-19 around in Nova Scotia when things shut down for March break. There's no concern. The schools have been closed for a week. I have no concerns at all about it, people going in a controlled manner, maintaining our public health direction of social distancing and no more than 5 people. Going into the school in and of itself doesn't create any risk for exposure to COVID-19.
Thanks for that question. Next, we'll go to Sharon Montgomery from the Cape Breton Post. Go ahead, Sharon.
Oh, thank you. I have a question for Dr. Strang, please. There are so many people continuing to work in essential services, and we're all very grateful to them. I'm getting a lot of questions from people who work in high traffic areas such as grocery stores, and they're wondering if there have been any studies on whether the virus can live on clothing, and if so, for how long it possibly could remain active, and what advice you could share for them.
So I'm not aware of studies specifically on clothing, but we do know in general, I'm much more concerned and that the studies around this virus can live for several days on what you've heard me say before, the high touch surfaces. It's a lot of places where hands can go, and I know the grocery stores, for instance, are doing things to keep people, minimize the number of people going in. Grocery stores are putting up plexiglass to protect the cashiers. They're doing things to adhere to the public health principles that we've asked them to. I think if people are concerned about their clothing, washing it after your shift in hot water and wash will take care of it. The most important thing to people who are working in those high exposure environments is good cleaning and very frequent hand washing. Those are the most important things to focus on.
Sharon, do you have a follow-up question?
Oh, yes, thank you. I'd like to ask the Premier, please. I know this kind of been addressed too, but I've gotten so many calls yesterday and today, especially from people that are employed with call centers, including a young mother of 3 children who was actually crying today, terrified to go to work. They all feel their employer's not complying with regulations that are in place. Another call today came from a building supply company, and they're concerned too many customers are being let in. Another employee was advised by 811 to self-isolate, but says he was forced to work. So I'm wondering, I know there's monitoring of businesses. What I'm wondering is the province receiving many complaints like this? And if so, is monitoring being stepped up, and how?
So no, we're not receiving a lot of complaints like this. We are, obviously people are wondering, are they an essential service? Can they continue to operate? It's very clear that the list of categories, what is essential and needing to follow the protocols of the public health. I can't speak specifically to the individual call center you're referring to, but those are the workplaces where we've seen creativity happening, where they've either split shifts, they may operate one stall, leave one vacant, have another one to meet the criteria of public health. That's the kind of creative stuff that we're telling employers they need to do. Same in banks. We're telling banks, you can have one teller, leave a space, have another teller. These services need to continue to go on. Our economy needs to continue to operate, but it needs to operate in the way that protects public health. If there are issues that people have related to that or don't feel that their employer is doing that, they can phone in and we will have it looked into. But there are periodic inspections that are happening in workplaces across the province. I know some of the sister provinces are doing it as well. But I would say to you, my experience has been that most employers want to cooperate and want to work with their employees. That's where this conversation should be happening. I don't want to lessen the anxiety that the person who called you is feeling, and I'm not ignoring it. It is real, and we want them to work with their employer, and their employer needs to work with them. I want to be very clear to employers across this province. We expect you to do everything you can to protect the health of your employees. It's in your best economic interest, and it's in the best interest of our province. That's what Nova Scotians do, whether you're an employer or an employee. You look out for one another and you protect one another, and we expect our employers to look out for their employees, and we expect our employees to look out for one another. And we will find our way through this. I have all the confidence that if we follow the advice of Dr. Strang and public health, of 14 days self-isolation, the separation of 6 feet, 2 meters, allowing essential services to operate, respecting our fellow citizens, making sure that we're home, we're exercising in the community we live in, all of those things that we can do ourselves will see us see our way through this.
Our last. Oh, go ahead, Dr. Strang.
So specifically to the question about somebody who's on self-isolation and feels they have to go to work, we have to understand employees and employers. The Health Protection Act order under my name it trumps any workplace directives. So many places, if you have if you're a unionized environment or you have occupational health and safety, if you feel that if you are required to self-isolate and you feel your employer is not respecting that, bring that forward for those routes. If you have no other route, then contacting your local public health office, because that is a directive that my medical officers are operationalized under my name, and we will help you out.
Our last question for today goes to Paula from CHNE TV in Cheticamp. Go ahead, Paula.
Thank you. What is the government doing to support rural hospitals who have fewer resources?
So I think you got to understand that rural hospitals are part of the Nova Scotia Health Authority, and so the Nova Scotia Health Authority is looking at how we make sure that across the province, that's why we have 6 COVID units in all of our regional hospitals. So they're well aware, and they're building capacity across the province of appropriate access to, first of all, COVID testing, and then hospitalization through our regional hospitals, where we have the capacity and the appropriate training for staff, et cetera, that we can build this network of COVID treatment units. So regional hospitals are part of the whole NSHA organization, and they're planning from a provincial perspective.
Paula, do you have a follow-up question?
Yes. Are people who have not traveled abroad or people who are not in contact with them, are they being tested? And if not, how do you know that you don't have any community-related cases?
So as I've answered earlier to a similar question, we have our ongoing influenza surveillance, which looks for signals of increased respiratory activity in communities that we would do COVID testing on. We are testing anybody who is in a hospital that, regardless of travel or not, if they clinically indicates that they might have an acute respiratory infection, we're, along with other things like influenza testing, where we're testing for COVID-19. And we're also now, as I outlined earlier, we're now testing anybody who's identified by public health as a close contact, and we're going back to our very first case. We are working with those contacts. They don't have to go through 811. We'll work with them to directly get them into one of the COVID assessment centers and do testing. And we're actively looking at ways that we further expand out into that community testing where it's not just based on travel.
Thank you, Tina. Keeping Nova Scotians safe and healthy is our #1 job. But I don't want you to think that we are also not focused on the economic health of our province. To our small businesses and self-employed, I want you to know that we know you are the heart of our economy, and I know you're worried. I am working with a team focused on finding ways to support you and your business during this unprecedented time. We're also getting our construction tenders out the door now, so that when it's time, we are ready for the work to begin to repair our economy. We are waiting for the federal government to confirm its programs, including EI, who qualifies, and what they are doing around tax benefits and how they are supporting social programs. This is currently before the House of Commons. When these programs get the green light, we will announce our own support. We want to make sure that there are no gaps, and we don't want to leave anyone behind. Thank you all for today, and we look forward to seeing you tomorrow.